So what's your question?
My mom has a mitral valve prolapse, and I'm curious about how that would affect her chances of having a heart attack soon or in the future.
Well, here's the thing, and that's the whole premise of the book. And the way I explain it in the book and to my patients is when you think of your heart, think of it like a house. Okay? And just like a house has walls, the heart has walls and it's pumping, and we call that myocardium. But the difference between a house and a heart is the heart's actually squeezing, correct? Mm-hmm. And just like we have rooms inside our own house, the heart has chambers, 1, 2, 3, and 4. The left atrium, the right atrium on this side is swapped like a mirror image when we draw it. The right ventricle, the left atrium, and the left ventricle. And just like you have doors to go from one room to the other, the heart has valves that allow the blood to go from one chamber to the next. So in my book, you'll find how the blue blood or the deoxygenated blood enters this chamber of the heart through the tricuspid valve down here, out the main door of the right ventricle, through a pulmonic valve to your lungs to get oxygenation blood, and then the red blood comes in, which is oxygenated, comes into the left atrium through this, and the mitral valve, what your question is, down into the left ventricle, out the aortic valve to the rest of the body.
So you're saying the mitral valve is here?
Correct. And when we're talking about heart attacks, we're not talking about a door problem. We're actually talking about plumbing. Just like you have plumbing and electricity behind the sheetrock, the heart has its own plumbing and electricity. So the heart has a front artery, a right artery, and a left artery that supplies blood to it to juice up its walls to keep it pumping.
Okay.
So see how they're so different? Like a mitral valve prolapse is a door problem, has nothing to do with a heart attack. Again, if you look here, this is on page 16 of the book. The same thing which I'm trying to draw is much prettier here. So these are the walls of the house, right? Okay. And just like we have plumbing, there's plumbing in your house. Yes. Just like there's electrical wires, there's electricity of the heart. And then just like there's the room, there are the chambers. And then this yellow thing here, which I draw as the walls, is the mitral valve. So when we're talking about mitral valve prolapse, mitral valve regurgitation, mitral valve infection, or when you go to your dentist and say you got a murmur, please, tell us because you need some antibiotics. We're talking about this mitral valve problem. Has nothing to do with this, plumbing that we're showing here. So this is, on like page 40, and I talk about, how the plumbing of the heart is set. So when we're talking about heart attack, we're actually talking about the plumbing system. The front artery is called the LAD. The right side is called the right coronary artery. The left side is called the circumflex. And that's what we're talking about. So coronary artery disease, the coronary artery system is the plumbing of the heart itself. And that's what causes a heart attack, is a blockage in the plumbing. Has nothing to do with the valve. So you can flip over to the valve section, which is right here, should be part number 6, and we can talk about the valves and how these valves work, actually your doors. So this is that mitral valve right in action, opening and closing as you're talking about, and I do talk about different kinds of valve problems, and when these doors are leaking, we call them regurgitation. And when they're stuck, we call them stenosis. So here's an example of a mitral valve leak because the doors are broken.
And that's where it's leaking back into the wrong chamber,
wrong chamber, because the blood is supposed to go from here down here, but it's now leaking back. And that creates an ineffective pumping system by physics. And here's where is an example of where the aortic valve is stuck. So rather than being big, it's small, and it's stuck at that position from calcium or rheumatic fever. And it gives a hard time, for the blood to get out, and it creates a murmur. So when you hear people say, I got a murmur, a leaky valve, a pig valve, a regurgitation, a torn valve, a mitral valve prolapse, we're talking about a door problem. It has nothing to do with the plumbing.